Did you know that there are serious health risks associated with untreated PCOS? If you have PCOS, it's important to be aware of diet and lifestyle factors that affect your blood sugar levels, even if your PCOS symptoms are under control. Today, I want to talk about why diabetes occurs more in PCOS patients and what you can do to prevent it. Hi, my name is Dr. Kathy Jones. I'm a board-certified gynecologist with over 25 years of experience in women's health. I've helped thousands of women learn how to overcome disorders and imbalances naturally. I teach women how to heal themselves using food as medicine and lifestyle adjustments. My desire for this platform is to do the same for you. So let's talk a little bit about PCOS. Polycystic ovarian syndrome. This is a condition that affects hormones causing irregular periods, fertility problems, and cysts on the ovaries. These symptoms are caused by an imbalance in the hormones estrogen and progesterone, and an excess production of the male hormones like testosterone. High levels of insulin are also associated with PCOS and cause the ovaries to make excess testosterone, which interferes with ovulation and causes some of the symptoms of PCOS like excess hair growth, thinning of the hair on your head, and acne. Excess weight is due in part to the insulin resistance, which may not be present in every patient with PCOS, but is very common. Weight struggles are common with PCOS. However, lean women can also experience PCOS. So now let's talk a little bit about the signs and symptoms of PCOS. Now, despite its name, you do not have to have cysts on your ovaries to have PCOS. The name itself creates confusion for a lot of women, but the cysts are not always present. The primary symptoms of PCOS are body hair. This is called hirsutism. Weight gain or obesity despite a healthy and active lifestyle. Infertility, the lack of a cycle or not ovulating, not releasing eggs. Acne, especially on your back and your chest. Hair loss or thinning of the hair on your head. Irregular periods or no period at all. Ovarian cyst, or an estrogen dominant sign like worsening PMS, painful periods, or even heavy periods. You can also have anxiety and depression. So when we make the diagnosis of PCOS, we usually have to have two of the following: excess male hormone or elevated testosterone, polycystic ovaries, which we see on ultrasound, or an ovulatory dysfunction, a sign that you're not releasing eggs, and typically that is an irregular cycle or no cycle at all. Untreated PCOS can lead to other health problems. Long-term PCOS left untreated can lead to metabolic syndrome. Now, metabolic syndrome is increase in your blood pressure, increase in your blood sugar, increase in your cholesterol, and increase in that weight around your belly and your love handles. And this can all lead to cardiovascular disease due to the chronic inflammation and impaired glucose. So this should give us a greater incentive to address our lifestyle, our diet, and hormonal factors that play a part in PCOS. Even if you're managing your PCOS symptoms with hormones like birth control pills, this doesn't address the underlying metabolic issues that place you at a higher risk for chronic issues like type 2 diabetes, heart attack, or stroke. So what are the important things to know about PCOS and diabetes? Now, with PCOS, you oftentimes have insulin resistance, where your insulin levels remain too high for too long because the cells aren't responding to their message. Now, this is a problem for a few reasons. One, for fertility, high levels of insulin can interfere with ovulation. Too much insulin causes the ovaries to produce more testosterone than normal, and this interferes with the healthy egg development, and this then can prevent ovulation. Without ovulation, pregnancy cannot occur. Two, for metabolic health, when insulin is constantly high, it creates inflammation, which can lead to weight gain, type 2 diabetes, and even heart disease. And the third reason, for energy levels. When your blood sugar isn't balanced and insulin isn't functioning normally, you can feel tired, run down, and have low energy overall. So how does PCOS affect blood glucose? PCOS is linked with blood sugar imbalances mainly because of the decline in the body's sensitivity to insulin. So let's unpack this. First, let's clarify how insulin affects blood sugars. So blood sugar is a measurement of glucose in our bloodstream. It goes up when we eat, and it goes down as our cells use the glucose for energy. But the glucose needs a helper to make it inside the cell. And the insulin is like the key that allows the glucose to open the door. Because PCOS can make the body less sensitive to the message insulin sends, this results in blood glucose levels remaining elevated for a longer period of time. Now, over time, elevated blood sugar increases inflammation and the risk of serious metabolic health issues like type 2 diabetes. So let me ask a question. Can untreated PCOS cause diabetes? Now, more than half of the women with PCOS develop type 2 diabetes by age 40. Now, this is alarming. Studies show that PCOS is one of the main conditions that can lead to insulin resistance and type 2 diabetes. And this can occur even past a woman's reproductive years, which is why it's important to address PCOS symptoms even if you're not concerned about fertility. And chronic inflammation from PCOS can cause the body to become less sensitive to insulin over time. And where did we say that chronic inflammation comes from in women who struggle with PCOS? The leaky gut. So check out my channel and you'll find a video where I teach about leaky gut as the root cause of PCOS. So when all of this happens, the blood sugar becomes elevated, inflammation increases, setting the stage for type 2 diabetes. Thank you so much for watching. I hope you enjoyed this video, and if you did, hit that thumbs up and subscribe to my channel. This is Dr. Kathy. See you at the next video.